to another episode of Rethink Healthcare. Woo! It's hot.
It's summer, it's hot, yes.
Summer, it's hot, but
I know. But as nurses,
I'm
don't
Wendy
matter.
Ball, and this is
Paul Montenegro, and doesn't matter if it's hot, cold, if it's sticky, there's a lot of bugs outside. If you're a nurse, you got to keep on working.
Unfortunately, yes. I have been so hot sometimes working. Like,
Oh, yeah.
even in a home care, you go into somebody's house and their air conditions out and you're just
But that's
sweating and you're trying to do wound care or something, but
Yeah.
you just got to keep it together, don't you?
Yep, that's life. I mean, it's 24 hours, it doesn't stop.
Nope,
So-
it doesn't. But we're not talking about that today.
No. Okay, let's. I'm really curious about how you manage your students and what is it that your students go through. There's this test that they have to take after they're done your program.
I know our topic today makes students sweaty for sure, and that is test taking, right? And
Yes.
at the end, we're coming to the NCLEX at the end, so we
Yep.
all have to be able to answer these questions, right? You
Yeah.
might know the material or feel like you know the material, but if you can't answer the questions, guess what?
Well, you have to be able to pass the board exam.
You do.
Simple as that. If you don't pass the board exam, you're not able to practice as a nurse.
Yeah, absolutely.
So, from your perspective, right? I mean, I don't have direct contact with students who are matriculated into a program going through an NCLEX scenario. What is the pain point that you find with the students?
I feel like they don't know how to take the test.
Really?
Yeah, I feel like a lot of them do, but I think it boils down to knowing exactly what the question is asking, because they might know the material, but they get sidetracked.
So it's not content issue necessarily, but it's more how the questions are posed.
I think it is. I think a lot of that is. I think they know the content. I think it's application, because we can memorize things and
Yes.
facts, but being able to apply it, understanding what the question's asking.
Yes. So when we were students, right, I remember we always, after an exam, right, and this is not even the NCLEX exam, right, just us going through our baccalaureate program. I remember after each exam, you don't know if you passed or not. At least that's how I felt. How
I
about
know,
you?
it's like, did I do, well, anytime you felt you did well, you did bad, and if you felt you did bad, you did good. I don't know.
Yeah, but it's always, and the reason being is, from my understanding, right, a properly written question will always have let's say it's multiple choice, right?
Okay.
A multiple choice question and a standard set of 4 choices, right? I mean, some could be more, right? Let's just to simplify it, right?
So, like for dinner, do you want steak, chicken, shrimp, or vegetables?
Exactly,
Is how-
something like
okay,
that. Yes.
okay.
So a properly written question will allow you to be narrowed down to 2. But then those 2 are very, very closely related that you're gonna have to pick your best choice. That's why you always feel that anxiety, at least for me, because I'm comfortable narrowing it down to the 2 for the most part, right?
Mm-hmm.
But then when you get there, you're like, oh, it could be this or it could be that. And that's where the clinical judgment really comes in sometimes. I mean, knowledge is knowledge, right?
Knowledge is knowledge.
But clinical judgment experience is where that would go. So I could feel for your students, because we were there at one point. But do you have any tips for that?
I think one thing that I find my students, because they'll come back and I'll let them kind of review their exam, because I think it's really good
Okay.
for you to see
Yeah.
what questions you got wrong, or you will continue to answer that question wrong again.
Correct, yes.
So a lot of times the students have come down to 2 answers, and they picked the incorrect one where they originally were thinking the first one. So if you're between 2 and you don't have a good reason to switch, stay with your initial answer. Stay with that gut initial feeling.
Yes,
Is,
yes.
is a good practice.
It's the same that we've been taught all this time, yeah.
Yeah.
So why is that though? I mean, why do you always say stay with your initial gut?
Why do we always stay with our? I think because I think we get sidetracked sometimes when we kind
Okay.
of dive too deep, and then a lot of times I have students saying, but what if this is with the patient, or what if this is going on with the patient, or what if they have this diagnosis? But that's not written.
Exactly.
Yes.
It's a thing, right? Every time you go, what if? You look at the question, did they tell you that?
Yes.
I mean, usually if there's a history in relation to the question, that's a clue
Yes.
that you gotta relate this history into what they're really asking you.
But if it's not written there, don't make up.
Don't make it up.
Don't
Exactly.
say like, oh, what if they have a history of diabetes? That could be a problem.
If they didn't say there's no diabetes history, well,
Or
you know,
not.
don't even lead into it. Yeah, so I agree with that. And we talked about instincts before, I believe, in prior episodes, and they're really there for a reason. Like your own intuition and instinct is it's from all you're born from all the recollections that you have all along. And then instinctually, okay, that's what pops in first. Even though you may not be too confident, it's the culmination of the thought process. That's why they always say go with your first
Go with your
instinct
first.
if you're torn between
Yes.
between two.
And then another thing you mentioned was, there's often more than one good answer.
Of course.
And sometimes you can't narrow it down to two. Hopefully you can, but if you can't, a lot of times they're all good answers, but what is the best answer, or what is the first thing, or what is the priority that we do with our patients?
Bingo, priority. Yeah, yes, because some questions will ask you to prioritize. For example, if you need to initiate referrals, you got 4 choices on which referral to do. All are appropriate.
Yeah, you're going to do all of them, but which one
do you
is the
do
most
first?
important that you do?
Prioritization questions, right? If somebody, if the case asks you, okay, which patient would you see first? Right? They'll give you 4 different cases. And in those 4 cases, right, how do you think through? Well, I need to see them all. Yes, we know that. But if you're prioritizing, who do you go to first?
Yes.
And we discussed that, I believe, in a prior episode.
We did.
Right?
We
Yes.
did.
And
And
yeah. I mean, ABC is one factor to look at that. Risk,
Because you're going to see all 4 of those patients. Yeah,
Exactly.
you're right. But which one is most important for you to see?
Exactly.
And that's where we're applying our skills. And that's what NCLEX wants you to be able to do, to prioritize and know who's most important, who's most urgent, who's most critical, to be able to see. So
Yes. So just keep in mind, right, when trying to work through the NCLEX questions, right, what they're looking for is really application of knowledge. They're not looking for memorization, because they do expect you to know some basic facts already, right? But then they want you to be able to apply that information, and then how to critically think through the process. I mean, that's whole part of the nursing process. You know?
another question I see students struggle with the most is those select all.
So like all that apply, yes.
questions.
They are very difficult. I mean, with the next generation NCLEX, I mean, there is actually a nicer one, meaning select all that apply, choose 2 or choose 3. So they make it easier for you. Out of the 6 choices you have, you only choose 3. So then
How many?
Yeah, I mean, I think the select all that apply was stuff. We didn't have that when we took it.
What? Yeah.
No, we didn't have that, and I
Thank goodness.
I really feel. Oh yeah, that's for sure. I really feel for you on that. And again, with that, I believe the approach is, if there's an inkling that this answer looks correct, just pick it and mark it off.
And I
Yeah.
think you need to look at the question. If there's 6 answers, if it doesn't tell you it's 2 or 3,
Yeah.
you need to look at it as 6 different questions. You need to read the question,
Oh.
read the answer, and then is that true or false?
That's a good read. I never thought
and
about
then
that.
read the question,
Yes.
read the answer, and is that true or false? So you're going to expect yourself that the select all questions are going to take you longer than a multiple choice question.
Of course.
Because they are 6 questions in one.
I think that's a very good tip. Yeah. So basically, break it down into this answer applied to this, yes or no,
Yeah.
and that and then but don't even bother going back. I think that just yes or no, and then once you mark them off, move on.
Move on, yes.
I think now they give you a bit of a partial credit on the select all that apply. Like before, they used to not.
It was all or nothing
Yeah.
before, and my students were struggling.
They were brutal.
And so I would say my exam scores, now that we're giving partial credit, student scores for just like their regular testing are going
bit
up
better.
like 1 to 3 points, and that's a big
huge.
difference. That is
Yeah.
humongous. Yeah.
That's huge.
Yes.
So how about we do this, right? I mean, let's wrap this episode up.
Okay.
But then, how about the next few episodes? Let's go through some questions.
I think that's a great idea. Let's do that. You guys
Alrighty.
think that sounds good?
I think so.
Yeah.
All right. Talk about it next time.
Okay.
Bye.